Signs of an ectopic pregnancy. 5 sure signs and symptoms of an ectopic pregnancy. 1. Tummy pain. You may experience tummy pain, typically low down on one side. It can develop suddenly or gradually, and may be persistent to come and go. Tummy pain can have lots of causes, including stomach bugs and trapped wind, so it doesn't necessarily mean you have an ectopic pregnancy. But you should get medical advice if you have it and think you might be pregnant. 2. Shoulder tip pain. The pain may have begun suddenly. Significant shoulder tip pain tends to develop with other symptoms such as feeling unwell, abdominal pain or vaginal bleeding, faintness, abdominal bloating and fullness. Pain when opening your bowels. It is caused by internal bleeding irritating the diaphragm, the muscle in your chest which helps you to breathe when you breathe in and out. Shoulder tip pain is exactly where it says, not the neck or the back but the tip of your shoulder. If you look to the left over your shoulder and then cast your eyes down, the tip of your shoulder is where your shoulder ends and your arm starts. 3. Discomfort when going to the toilet. You may experience pain when going for a pee or poo. You may also have diarrhea. Some changes to your normal bladder and bowel patterns are normal during pregnancy, and these symptoms can be caused by urinary tract infections and stomach bugs. However, it's still a good idea to seek medical advice if you experience these symptoms and think you might be pregnant. 4. Vaginal bleeding. Ongoing bleeding that is sometimes red or brown, black and watery should be investigated. The bleeding may be heavier or lighter than usual. When seeking medical attention, opinion. You will be asked for your last menstrual period, which should be your last episode of a normal flow and duration bleeding. It is important that abnormal bleeding does not get confused with a normal period, as healthcare professionals may think you are much less pregnant than you are. Prolonged off-on light and sometimes heavy bleeding are quite often seen in ectopic pregnancy and should always prompt a pregnancy test, and if positive should be urgently investigated with an early pregnancy unit referral. 5. Abdominal pain. It is not uncommon in pregnancy to experience a period-like ache in your lower tummy and back. The following, however, should be investigated. One-sided pain in your tummy, which may be persistent or intermittent, which means it can come and go. The pain may have begun suddenly or gradually. A generalized discomfort with bloating and a feeling of fullness, not associated with eating, when lying down, particularly in women who have already had a child. Significant lower abdominal and/or back pain.